Good evening and welcome to our COVID-19 update. I am Ladi Akere-Doluale. Here are the highlights at this hour. Federal government to reduce fiscal communication as it reorganizes strategy for fight against COVID-19. Presidential task force still investigating Jabi Mall Naira Marley breach of national COVID protocols as it processes strategy for funding of states. And Chinese pharmaceutical company promises its COVID-19 vaccine will be ready by the end of 2020. The Presidential Task Force on COVID-19 says it might consider restructuring its mode of delivering some of its activities, relying more on technology in order to reduce the risks of contracting the virus. The task force suspended its briefing on Monday after the Minister for Foreign Affairs, who is a member of the task force, announced via his Twitter handle that he had tested positive for COVID-19.
The Presidential Task Force might reconsider restructuring the mode of delivering some of its activities, relying more on technology to minimize the risk associated with unavoidable physical contacts. The next phase is for the aviation regulators to engage with other stakeholders to facilitate an integrated and seamless resumption of international flights. I plead with all Nigerians to await authentic information from the aviation authorities and discountenance fake news and speculation on dates. As we approach the last 5 days to the end of this eased lockdown phase, the Presidential Task Force shall rigorously evaluate the developments on the basis of emerging data, evolving science, strengthen best practices and improvements in our risk communication strategy. All this would help us form an opinion upon which the next set of recommendations to Mr. President will be based. We urge all state governments to ensure that guidelines are adhered to, and citizens should not indulge in activities that would allow for the spread of the virus and lives are endangered. We are encouraged by state governments that have announced ban on Salah festivities and hope it will be upheld and replicated by other states.
President Muhammadu Buhari has started an initiative that will ensure that Africans have access to COVID-19 vaccines. The Minister of Health, Dr. Osage Ehanire, says Nigeria is working with many other countries to ensure that Nigerians are not left behind in the effort to access the vaccines whenever they are ready.
With the question of vaccines, yes, we are observing the development on the vaccine. There are several vaccine candidates being tested in various countries right now. Everybody is scrambling to get the vaccines. The High Commissioner of India spoke in that respect when he visited us some time ago, just a couple of days ago, to say that India is also working on developing a vaccine. I've heard the president of China make the same statement. In America, they're obviously doing a lot of tests, and the UK and other countries in Europe, everybody is scrambling for vaccine. Now, His Excellency the President has started an initiative by which the African bloc of countries should work towards getting access to vaccines. That initiative is ongoing to be able to make sure that Africans are not shortchanged when vaccines do come out. And it's our prayer that these vaccines come out in large areas, in large numbers and in multiple sites.
Meanwhile, the federal government is carefully studying the option of moving the West African Examination Council exams to November. Speaking today at the Presidential Task Force on COVID-19 briefing in Abuja, the Minister of State for Education, Mr. Emeka Wajuba, says this will be the final option should the current plan fail. Mr. Wajuba says the federal government is currently working with the examination body to ensure that students write the exam in a safe environment.
WAEC unfortunately, is unable to wholesomely move the exams. But we have also worked out a negotiated timeline with WAEC such that what we call peculiar Nigerian subjects, which in the language of WAEC are subjects that are only held in Nigeria. That's Igbo language, Hausa language, Yoruba language. These are language exams. These are some what we call peculiar. They are peculiar only to Nigeria. We will now work out a domestication module that will take our peculiar subjects behind after we have done generals. This will buy us the time we need for all of us to be able to come to be at par with the rest of West Africa and operating at the same time. Because the unanimity with which WAEC has always worked is still very important to us. Nigeria is not moving away from it. The option would have been to go to November to take the GCE external exams. Nigeria is carefully studying that if in the event that everything fails, we may go to that. But we are working assiduously to keep within this time frame so that everybody will work within this. But the key factor of safety, we will not open these schools until we see and are sure that children can go in there with as maximum safety as possible.
Staying with the PTF briefing, the national coordinator of the Presidential Task Force, Dr. Sani Aliu, says the federal government is still investigating the Jabi Mall Naira Marley incident, which occurred earlier during the COVID-19 period. Speaking at the briefing today, Dr. Aliu also spoke at length about the strategy of the PTF to ensure that funding to combat COVID-19 gets to states.
Has repeatedly said that we will not sit down and just watch while people clearly flout the rules that have been put in place for the good of the public. We have formally requested for investigation of the Jabi Lake Mall, and at the highest level, we've also requested for legal processes to come in place. I believe that's still being investigated. I have requested for an update from the relevant authorities. And once we have an update, we'll let you know. There are additional funds that are coming directly from the federal government based on the National Assembly budget that has just been passed. That money has not been released yet, but is certainly in the budget, 2020 revised budget for the states. We have developed a template working with the state governments and the Nigeria Governors Forum that outlines the key parameters that will be used to allow states to access these funds. And we are working very closely with all the states. Some of the states have already fulfilled some of these requirements. For those that haven't fulfilled it, we are working very closely with them to make sure that they fulfill the requirements in line with the national COVID response. And as soon as they do so, we will sign them off.
The nation's commercial capital and epicenter of the COVID-19 pandemic, Lagos, should reach its peak in August 2020. And that's according to the State Commissioner for Health, Professor Akin Abayomi, while giving an update on the management of COVID-19 in the state today. Professor Abayomi adds that any private health facility found conducting COVID-19 tests without approval or using rapid test kits will be sealed.
COVID-19 numbers in Lagos are increasing every day, with 13,543 cases till date, fueled by community transmission, which the state health authorities are battling to curb the spread.
7 private laboratories.
The State Commissioner for Health, Professor Akin Abayomi, believes Lagos is nearing its peak, which is expected very soon.
We're still seeing a gentle increase in the number of cases over time, cumulatively. According to our modeling, we expect that Lagos will theoretically peak in the month of August, and then it will flatten out and after some time, we will start to see a decrease in the number of cases.
Lagos remains the epicenter of the virus, with Etiosa, Alimosho, Koshofe, Ikeja, Oshodi, and Isolo local government areas the worst affected. While testing will be carried out in these areas, the government will still spread sample collection across all local council development areas.
Nobody has developed a rapid diagnostic test that is safe enough for us to use in community. We will increase our sampling in the local governments. So we had already established 20 decentralized sample collection points, but we're going to make those 20 collection points a lot more efficient and a lot more active. And indeed, we're going to increase that to 57. We have started what we call the COVID-19 outpatient facility. So once you're discharged from our isolation center, we monitor you, and we're planning to monitor you for up to 6 months and perhaps a year.
Another burning issue is the fate of students who remain at home due to the closure of schools. The government says there is no decision on resumption.
There is yet no date. How Lagos is going to cope, considering the number of pupils and students that we have. I assure you that as soon as the go-ahead is given for schools to be reopened, Lagos is going to cope. Work is on now to ensure that we obey all the guidelines, all the COVID-19 protocols, so that our students and teachers do not get into trouble.
As the Lagos State government continues to battle with the pandemic, residents are advised to continue to adhere to safety guidelines put in place by the authorities. Titilayo Aberewo, Channels Television News.
Community leaders in Yobe State say their wards have received adequate sensitization on the COVID-19 pandemic through various means of communication in the last 4 months. They have explained that those who are not observing the safety protocols were as a result of economic challenges which have hindered them from acquiring such safety items.
In Yobe State, sensitization exercises were carried out through different means, like the media, traditional institutions, worship centers, amongst others. These have yielded results, and even children on the streets are now aware of what the coronavirus disease is all about.
It is a disease that can be contracted from person to person. Its transmission can be minimized through hand washing in a running water, avoid large crowd, and keeping environments clean.
As I'm talking to you now, go to every nooks and crannies of this state or even northern part of this country. You know, our people are good in current affairs. People are aware of COVID-19 or coronavirus. They know what coronavirus is. They know what coronavirus can do. They know it kills.
The community leaders are asking government and non-governmental organizations to assist their wards with the safety kit, as some are willing to use them but do not have enough money to buy them.
People have accepted that the disease is real, and they have taken very much care of what has been talked on. So poverty can also be seen as some reasons for people not wearing it, and also ignorance, and maybe some deliberate refusals.
No doubt, carrying out more sensitization in a simplified way will help reduce community transmission.
Let's take a look at the NCDC figures of Nigeria's situation as at today, as at now that we're speaking in the studios. Nigeria has 38,344 cases, out of which 15,815 have recovered. Unfortunately, 813 people have died, and that leaves us with an active caseload of 21,716. 543 new cases were diagnosed in the last 24 hours. And of that number, there is quite a number of states that are represented, but some are quite heavy. Lagos, of that number, has 180. The FCT has 86. Kaduna has 56. Edo, 47. Ondo has 37, just to mention a few. The number of samples tested as at today is now 250,000, precisely 251,893. Now let's take a look at one of the states in this country going through the COVID-19 pandemic. Now that state would be Niger State, if I have it correctly. It's taking its time to boot up. Okay. Okay, we're back to this. So at this point, let me drag this out and go to Niger State. Here comes Niger State. Coming to Niger State here, we should have 166. That's right, 166 confirmed cases. That's what Niger State has. Now, of that number, more than half of that number is just from one local government. That's Chenchaga. And if you have listened to Emperor Simon talk from Niger State, you will understand why Chenchaga is one of the big states. But if you take a look at what is going on in that area, this is Niger State. You have some really big hotspots, like in most other states that we have taken a look at. Mina, Kontagora are two of the big states, two spots rather. Mina is the capital of Niger State, so traditionally one would expect that a lot of cases would come from there, because this will be one of the regions that the authorities will be doing quite a number of tests from. Another big spot is Kontagora, yet a third one is Bidda. Now, what these two areas have in common is that they are passageways for those who are traveling through the state to other areas of the country. So it makes the possibility that you can have a lot of people going back and forth, and therefore you can't really keep them in one place and confirm whether or not they have this kind of difficulty. So you do have Chenchenga, you have Suleja, Bidda. The numbers are small, but as we tell you at every point in time, this is the issue of testing. Only 166 tests have been conducted or rather only 166 people have been confirmed positive. Niger State's number is very, very small. Perhaps like with other states, if more tests are conducted, we'll find out if more people are positive. Let's take a break. When we come back, we'll talk a little bit about this and a number of other issues. Please stay with us. Thanks for staying tuned. Welcome back to our COVID-19 update. Since the outbreak of the COVID-19 pandemic, people from around the world, including Nigerians, have been seeking information about this virus. The World Health Organization and other health bodies like the Nigeria Center for Disease Control, the NCDC, have been racing against time to unravel so many things about the highly infectious disease and give out as much accurate information as they can. But how much of this information gets to the people, and how is misinformation hurting the fight against COVID-19, particularly in Nigeria? To look into this and the other issues concerning COVID-19 risk management and community engagement, I'm being joined on the program via Skype from the Ogba area of Lagos by public health physician Dr. Oladapo Asiobi. Dr. Asiobi, thank you for your time. Welcome to the program.
Thank you very much, Ladi, and good evening, viewers.
I know this might sound hackneyed, but that's where I'm going to start. The last time we spoke, the numbers were in the low 30,000s. Today, we're talking about 38,344. Not surprising?
Yes. At all. You mentioned it even earlier.
I did.
It's actually a low number.
It's actually a no number, yes.
So it's not. So it's not surprising at all. We should even be higher if we are doing enough testing. Now, that is not strictly because the testing capacity is not there. Now Nigerians seem to be aloof, so more people are not submitting themselves for testing. The capacity is there, but we don't have enough people coming in to be tested. So like you said, this is a risk communication. So most Nigerians believe that their risk is low. So if you believe your risk of catching COVID is low, then you will feel no need or push to go and submit yourself for testing. So I think part of the message tonight is, please, COVID is out there, it is real. it is rampant. Please submit yourself.
What do you think we're doing wrong, though? What do you think we're doing wrong about this communication, the risk management or risk communication strategy? I mean, SARS passed through Nigeria, Ebola passed through Nigeria. We've just been declared polio-free. I mean, all of this at some point needed community engagement and so on. What is it that we're doing or that we're not doing this time? Why do people have the belief that you've just talked about, which is that their risk is low and therefore there's no need to test themselves?
Okay, so let's put COVID in the middle of Ebola and polio. You know how long it took us to get polio kicked out. It's very similar to COVID. People believe their risk is low. Now, polio's own is even funny because it had a vaccine. So even if people were going to catch it, I mean, because of the routine immunization, quite a lot of people will be tested. Because of the supplementary immunization activity, that is the house-to-house that usually occurs like 3 or 4 times a year then. So people will also get immunized. So because vaccine saves a lot of lives, so people believe that their risk is low. I mean, why do I need to vaccinate myself when I'm okay? My child is okay. It's only the children of those who come down with paralytic polio that understand what we mean. Now, it is only those who have been infected with coronavirus or whose family have been affected by somebody being infected or somebody dying that can tell you that their risk is 100%. But every other person who has not caught it believes that their risk is 0. And so they take risky behavior. The truth is this, coronavirus is very infectious. It can happen to anybody. There is no age that is free from catching it, even if it affects elderly more, but everybody is at risk. So we need to understand that very clearly. But what is more painful from parts of the conversation coming out from the presidential task force is that VIPs who have street credibility, who the people will listen to, I mean, the debacle in Abuja is something to point to, are the ones encouraging people to disobey gatherings. And they put them at risk because of their status. I think we need to be more responsible if we have been put in a position of influence. Thank you.
The other thing there is going forward, I'm happy you mentioned the VIPs and what went on at some of the nation's airports and other ports of entry with regards to the protocols. But the other thing that seems to happen is that at the base level, it's not that people are not aware. People are aware of COVID-19. They have been told about it. They know how deadly this can be and so on. But they're not just complying. And that brings up the contentious issue that people have brought up from time to time, which is getting there to be some sort of enforcement. I mean, even in the societies we aim to emulate, the Western liberal societies, there is enforcement. There is enforcement.
Yes. However, the challenge with the enforcement, you can listen for your people. Without COVID, we were police short. Add all the security agencies, there will still not be enough for police. Like you said, in societies where there is more awareness than us, they're also not complying. It's just a funny thing about behavioral change. This is a behavioral change communication problem where people don't believe their risk is high until they are infected or affected. Now, policing is a big challenge. You have to have resources. You will start policing people wearing masks, people not gathering, celebrities behaving themselves, VIPs behaving themselves. There's so much more you can do. I mean, you now have to, you have to pour resources into that. Now you now take away resources that are used to treat, test, to control, to what? To risk policing. It's policing people's perception of risk. Now, what we need to change is to try and see how we'll engage the people better in a way that they themselves will come out with strategies that are community-driven in every street, every CDA, every CDC, every village, every hamlet. Let them tell you how they want to respond to COVID. If they tell us how they want us to cooperate together, then it makes life a bit easier. For example, you need to engage the VIPs and then let them tell you what can go well, what can go right. So VIPs are used to being pampered and managed. So how? How can you do it safely? People go to the market to shop, they don't use face masks. Please ask them, ask the market leader, how can we do it safely? How can you be your own enforcers? How can resident association be their own enforcers rather than police? So this is like doing community policing for pandemic.
All right, then. Thank you so very much, Dr. Oladapo Asiobi, for your perspective on this topic. Thank you for your time on the program as well. Part of the mandate of the National Orientation Agency is to consistently raise awareness, positively change attitudes, values, and behavior, and adequately inform the citizens. But how well has this agency carried out its mandate in the face of the COVID-19 pandemic? Its Director General, Dr. Garba Bari, joins us now from our Abuja studio to share with us what impact the agency has made so far in the national COVID-19 response. Dr. Bari, thank you for your time. Welcome to the program.
Thank you very much, Larry. Very good evening.
The Presidential Task Force at today's briefing, Dr. Aliu in particular, Dr. Sani Aliu, its national coordinator, says that the Orientation Agency has been doing quite a bit to enhance awareness and enlightenment programs, particularly at the community level. Many people will ask how, where, because if you listen to our previous speaker, the public health physician there, he made mention of the fact that if you just need to go out, you find that people are not complying, they're not obeying the protocols, and this has been consistent right from when the lockdown was eased. What is your agency doing?
Well, that is not because the agency has not done what is expected of it to do. On a scale of 1 to 10, if you ask me, I would say 95 to 98% of Nigerians are aware of COVID-19, are aware of its realities, are aware of its deadly nature. And this is just a function of how much sensitization has gone out there. If you have a small child at home that has not been going to school since the lockdown, and ask him, why are you at home and not in school? He will tell you it's because of Corona or because of COVID-19. That tells you how much sensitization has gone and how much of public enlightenment has taken place on COVID-19 and its realities. However, what we are witnessing, and this is the experience of the National Orientation Agency deriving from its reports from the field, is that in spite of the awareness which has been engendered by the public enlightenment and the sensitization efforts of government, citizens are largely in denial. And first, because they tend to see themselves as, with their risk aversity as very low. They have very low risk aversity, and for this reason, therefore, they don't want to believe that they are vulnerable to being afflicted. We have passed the stage of public enlightenment. We are going into the stage of behavioral and attitudinal change. Behavioral and attitudinal change where Nigerians must have to begin to take personal responsibility. When you begin to take personal responsibility, you keep yourself safe and you also ensure that you are guaranteeing the safety of the other person with whom you are coming into contact. And this is something which at various levels, at the levels of the PTF, at the levels of the National Orientation Agency, sensitization and advocacy, at the level of what is being done by subnational units, the states and in the local governments, this is being done. But what you see, however, is that people go about everything, as if, business as usual. Now, the point that I feel, and I think government must have to begin to think of the possibility of enforcement. I mean, the world over, every country is devising its own means by which it responds to this pandemic and the challenges that arise from the responses. In our own case, we have a very large population. Perhaps, I am not one of the experts, but perhaps the experts may explain that placed against our large population, the cases that have so far been reported below 40,000, placed against a population of nearly 200 million, you may say this is actually not something that is worthy of being given attention. But you can also see that in the last 3 months, or in the last 2 months, how exponentially the numbers have been rising, and even that of affliction and of the fatalities. So I feel that there is the need for government to begin to think of ways and means of enhancing moral suasion. Where it fails, we begin the process of enforcement. And in the process of enforcement, once it is done within the excellent regulations and the excellent provisions of the law, definitely it will be in line with what is expected of government, protection of lives and the protection of security of property. But this is not to say, however, that we will relent in this. Community to community, in local languages, for people to realize the dangers of not taking personal responsibility. Not to know about COVID. No, the dangers of not taking personal responsibility in obeying the prevention protocols. If you do that, you save yourself, you save the other person. Secondly,
let me interrupt you, Dr. Barry. Sorry, let me interrupt you, Dr. Barry, and ask you this. People say that a lot of the awareness and so on is going on first in the urban areas, not in the rural areas where most of the population currently resides. That's number one. Two, that at the community level.
I disagree.
Okay, fine. At the community level, that a lot of individuals know about it, but that the force of community suasion and peer pressure from community members has not been leveraged upon to ensure that people take responsibility for their actions. What's your reaction to that?
Tell me what is happening. What is happening, Ladi? Tell me what is happening in Lagos, which is different from what is happening in Kano and what is happening in the remotest community in Jigawa or in Yobe. It is just the same attitudinal and behavioral thing. If you take a walk on the street in Lagos, you see people wearing the mask on their chin. Or some are wearing it in the taxi drivers are hanging it in the cars, so that if their passengers don't have it, they just bring it and give it out and give it to them to hang out, so to hang on their chin, not even on their face, to cover their mouths and to cover their noses. So this tells you that there is definitely a widespread enlightenment and the knowledge and the awareness about the disease. What we are saying is, as in Lagos, as in Kano, as in Portiskum, as in Ikene, as in Onimo local government, as in everywhere, the same attitude, the same behavior is being replicated, and that's what we are seeing. There is no difference in what is happening between the urban and the rural communities. And this is something which is empirical, and I have this on my fingertips because it is a report I'm receiving from the field.
Going forward, then, what are we to do? What are we to do? You talk about enforcement, at some level of enforcement, if the moral suasion and so on doesn't work. But then there are those who have pointed out, including our last speaker, that even the issue of enforcement, those to do the enforcement themselves don't seem to understand what is at stake. In this case, the security forces. During the lockdown, many vehicles were traveling from state to state. How that was happening with borders being shut remains a mystery. Up until now, many security agencies are out there, many of their officers and men are out there. They are not wearing any personal protective equipment themselves. So how does one expect them to enforce it against the citizens?
There are very many centers of power locations in this country. That the enforcement doesn't necessarily have to come from the police or from the army or from other government agencies. Government could be one, or one of the options. But there are societal ombudsman. There are communities that can impose their own laws using their own traditional cultural methods of social compliance. These are some of the things that we need to look at. I agree entirely with the second speaker, the doctor who spoke before me, that communities must have to be engaged, and engaged fully, so that they become part of the solution and not to be seen as a problem. What do resident associations, how do they enforce? How do they ensure that everybody actually in the estate, in particular, abides by the prevention protocols? How do market associations or market authorities ensure that the market men and the market women who go in there every morning and every afternoon to sell come up with their own internally generated responses, to some of these things? Because the issue is not only about government alone. This must be the responsibility of each and every citizen. And that is why I'm emphasizing on personal taking of responsibility, so that you save yourself and you save others.
Thank you very much indeed, Dr. Abari, Dr. Garba Abari, Director General of the National Orientation Agency. Thank you for your time today on the program.
You are welcome. Thank you so much.
Let's go outside our shores, where in South Africa, all public schools are to be shut again from tomorrow till August the 24th, except grades 7 and 12, who will be phased back in a bit earlier. So says President Cyril Ramaphosa, who addressed the nation this evening of the debate that has lingered for a number of weeks. He also spoke on the management of funds deployed to the pandemic, as well as his government's plans to investigate and prosecute those found guilty of the theft, wastage, or mismanagement of COVID funds. The number of confirmed cases in South Africa currently stands at 408,052, and President Ramaphosa says, following wide consultations, as well as the World Health Organization's recommendations to reopen in the context of low community spread, the current rise in numbers has moved Cabinet to close the schools.
Cabinet has decided today that all public schools should take a break for the next 4 weeks. Now, this has also been the experience in a number of other countries, where schools have opened and have also had to close due to the circumstances that each country has had to confront. This means that schools will be closed from the 27th July and will reopen on the 24th of August. There are, however, some exceptions. Grade 12 learners and teachers will only take a 1-week break, from now returning to school on the 3rd of August. Grade 7 learners will take a 2-week break, returning to school on the 10th of August. Specific arrangements will be made for different categories of special schools. As a result of the disruptions caused by the pandemic, the current academic year will be extended beyond the end of 2020. The Minister of Basic Education will provide details on the management of the remainder of the school year. We have taken a deliberately cautious approach to keep schools closed during a period when the country is expected to experience its greatest increase in infections. Throughout this period, the National School Nutrition Program will continue to operate so that all learners or their parents can collect food directly from schools.
President Cyril Ramaphosa of South Africa. Staying on the African continent, Uganda has recorded its first COVID-19 death. The Ministry of Health said the victim was a 34-year-old woman who died after being admitted for what was thought to be pneumonia. 30 people who potentially came into contact with her have been placed under quarantine, and contact tracing is underway for others who may have interacted with her. Uganda has recorded 1,079 cases of COVID-19. The country began a phased ease of lockdown restrictions in May, and on Wednesday allowed traders in one of the most congested areas of the capital, Kampala, to return to reopen their shops. A COVID-19 vaccine developed by Chinese pharmaceutical company Sinopharm could be ready for the market by the end of this year, so says Sinopharm chairman Liu Xinzhen. He says Sinopharm has built production facilities to ensure mass production of the vaccine in the next step, and says clinical trials are in the final stage, that's phase 3, and will be finished in about 3 months. The vaccine is being jointly developed by the Beijing Biological Products Institute and the Wuhan Institute of Biological Products under the Sinopharm Group. Many United States are setting new records for COVID-19 cases as the country inches closer to the 4 million mark. States like California, Missouri, North Dakota, and West Virginia have recorded their highest daily infections, while Alabama and Idaho and Texas reported new record highs in daily deaths. Here's the global update.
Official guidance on revised rules for face coverings in England have been published. From Friday, coverings will be compulsory in enclosed public spaces, including supermarkets, indoor shopping centres, transport hubs, banks and post offices. Over in Spain, authorities say face masks should be worn even at home if residents are with people they don't live with. Spain already has Europe's strictest rules on masks. In Madrid, they are mandatory everywhere in public. Away from Europe, wearing face coverings outside the home is now mandatory in the Australian city of Melbourne and Mitchellshire. The move came into effect on Thursday after a surge in cases in the state of Victoria. As America continues to grapple with the biggest outbreak in the world, infection numbers are nearing 4 million. Deaths resulting from the virus have also risen to more than 143,000. New York, which was hit hardest at the onset of America's outbreak, continues to have the highest number of deaths in the country, but infection rates have risen sharply during recent weeks in southern states like Florida and Texas. California, the most populous U.S. state, has already overtaken New York in case numbers. A new report says the South African Medical Research Council is reporting a huge discrepancy between the country's confirmed COVID-19 deaths and the number of excess deaths from natural causes. The report shows that more than 17,000 excess deaths in South Africa from May the 6th to July the 14th, as compared to data from the past 2 years, while confirmed COVID-19 deaths are 5,940. And in the Middle East, coronavirus cases have passed the 100,000 mark in Iraq. The news comes as the country resumes commercial flights from some cities for the first time in several months. Neighboring Iran remains the worst affected country in the Middle East, with more than 284,000 cases and over 15,000 deaths. And finally, a hospital in the southern French city of Lyon is testing patients with a new machine that enables them to breathe into a tube to see whether they have COVID-19 in a matter of seconds. The machine is entering a second trial phase after 3 months of use on dozens of people, among which about 20 were patients with the virus and others without. Unlike the uncomfortable standard PCR tests, the machine is not invasive and provides an immediate result.
And that's our COVID-19 update for today. Just before we go, let's update you with a tally from the United States. The number of confirmed cases now in the United States has topped 4 million. For details of that and others, please go to our website, channelstv.com. You'll find their stories, both local and international, both on COVID-19 and all other topics. I'm Ladi Akiridoluale. Good night.